All right, well, thank you and welcome everybody to the Re-AIM and Great Plains Ideas CTR webinar that's reviewing the Dissemination and Implementation Science National Conference from 2020. And we're just going to start with a quick question for Dr. Bridget Gaglio, who was on the planning committee. And the question is, who is on the planning committee? What's the review process? How might someone get on the planning committee? And how are talks and seminars selected?
Russ, that's a great question. Thank you for asking it. So the planning committee consists of a lot of folks from NIH and a couple of people from Academy Health, since those are the major sponsors of the conference. I represent PCORI on the panel. There are folks from the VA, Robert Wood Johnson. I'm sure I'm forgetting some other organization, but basically anyone who's sponsoring the conference has a seat at the, at least a seat at the table on the planning committee. I want to say it's maybe 15 people. And Gia Netta and David Chambers from NIH or NCI are the lead organizers for the meeting. Then in addition to the planning committee, every year we solicit participation for a scientific kind of panel of lead people in the field of D&I to provide guidance on either potential topics or keynote areas of emphasis for the meeting. And so that usually consists about 5 or 6 people as well each year, but they are really included in the very early stages, and then the rest of the time the planning committee is taking charge of everything. In terms of what the process is for selecting presentations or posters for the meeting, the call for abstracts opens in the summer. I want to say May, June. I bet it's summer sometime, and then during the summer, a lot of people who volunteer their time, who have offered to review the abstracts, will be aligned with a particular track, and we have about 5 people review each abstract. And then within the track, the co-chairs, myself and Lori for Models, Measures, and Methods, we review all of them. So we know what came in. And so for like our track, we always get over 100 plus abstracts and we read them all. So we know what we received so that we have an idea of, so when the scores come in, we're starting to already think of potential themes or groupings depending on how the scores fall out. You have the option to submit a panel. And so that's all or nothing. So if the panel scores really well in the review, then we usually will accept the whole, the panel. But if the panels don't score well, then unfortunately we don't split them out and accept one part of the talk, or it's all or nothing. As for the independent individual abstracts, then the ones that scored really well, that's where the co-chairs sit down together and try to decide how to group them to make a meaningful panel presentation. And then after that, once all of our panel allotments are filled, we then start looking at posters. And we decide basically a score threshold, like anything above this score will be invited as a poster, anything below will not. And then there's also all kinds of other fun types of nominations. You can do best abstract, best poster, and there's all those kinds of groupings as well to create other types of panels and opportunities to review some of the higher ranking abstracts that we received.
Perfect. Thank you, Bridget. And that was excellent context. And we're going to jump into now some content stuff. And I'm going to start with Dr. Ross Brownson from Washington University in St. Louis. Ross, you told me that you like the big picture focus that you heard from Ashish, I think it's Jha's session. And so I wanted you just to go ahead and expand a little bit on what you thought about that and what you took away.
Yeah, thanks, Paul. Yeah, I thought, so those of you who attended, you'll remember Ashish Jha did the opening talk, the first morning. I guess it was morning for some and afternoon for some, I'm not sure. And he was at Harvard when I think when the pandemic started, and then moved to Brown. He's the dean at the Brown School of Public Health, and he's an infectious disease person. And he was, I thought it was real. First of all, if you watch CNN, he's on CNN all the time, so you see him, and I just think he has a really great style. He doesn't, oversell what he knows. And one of the things that he talked about through this pandemic that we learned was the idea of being humble and knowing what we don't know, because it was definitely one where we're building the airplane while we're flying it, because of a novel virus is what the name says. He also, along those lines, is sort of, you learn as you go. You learn about what works and what doesn't work. You have to recreate. And so this is true in implementation science. We learn from our mistakes. And then, he spent a bit of time, and I think had a question, if I remember, around this idea of misinformation. And of course, that has been such a big thing through the pandemic. And, people sort of, one group calls it misinformation, some call it disinformation, some call it malinformation. There's a continuum there. Usually misinformation is an unintentional error where a policymaker is giving a talk and he or she makes an error and it wasn't intentional. Misinformation is when someone is intentionally, they know better, but they're intentionally putting out false claims, like the election was stolen, for example. A third kind is malinformation, where someone is intentionally trying to harm someone else, where they might be fabricating a story about someone else that's going to harm them in some ways. And so in a way, this is it's a de-implementation challenge we face. And it's one we're facing now. If any of you work in the vaccine area, that's always been there for vaccines, but with the rollout of the vaccine, how do we counter what is probably mainly misinformation, where people are putting out false claims about vaccines, and how do we de-implement false notions that have been out there, in this case around the coronavirus. And I think that, sort of the bottom line for Dr. Jha had to do with having messages that are clear and concise, knowing your audiences. Think about that for vaccine uptake. How do we know our audiences? How do we address a lot of the implementation challenges for populations who generally have low vaccine uptake to start with, and then might have historical reasons, such as African-American populations, for mistrust of a healthcare system. And so there's going to be a lot of work in that is probably the most massive and most rapid implementation challenge we've ever had on the globe. When you think about getting billions and billions of people vaccinated in a pretty short period of time, and along with that, I guess it's thinking about all the other related public health measures that are going to need to be continued during this time. I think a lot of people have this sort of light switch thinking about the pandemic, where once the vaccine's there, oh, I'm vaccinated, I don't need to wear a mask anymore, I don't need to worry about physical distancing anymore, we can go back to life as usual. And I think most people think life is not going to go back to the way it was roughly a year ago. And so we're going to have to continue to adjust to that. And I think so there's going to be a combination of sort of medical approaches, public health approaches, and state-of-the-art communication and behavioral science approaches that will help us get a lot of these messages out. And so I thought it was a good framing. It built into a couple of later talks, one in particular by Chris Murray, talking about some of the data issues. But I thought what I found most interesting, I think, about that kickoff big picture talk was how it framed some of the macro issues that I think our field in implementation science is facing right now. So I think I'll stop there.
That's great. Thank you, Ross. That was really good. And I think it ties into one of the things that Dr. Meredith Fort from this Colorado School of Public Health. So Meredith had mentioned that she was really struck by the increased emphasis on policy, which obviously when we're talking about macro level things, there is going to be more need for a focus on policy. And so I'm going to kick the floor to you, Meredith, and let you expand on that.
Yeah, thank you. So definitely a highlight for me was seeing the increased emphasis on policy. And And I saw that especially in two sessions that were both on the last day. So the closing plenary, and then there was a session a little bit earlier in the day that was facilitated also by Karen Emmons, which was on future directions in health policy and D&I. And one of the sessions there that I enjoyed the most was on dismantling of policies, focusing on state level food environment policies or health protections. And just thinking about kind of all of the opportunities that are out there in the limited emphasis that we have had to date on policies. And some of the future directions that Ali Awazid talked about were needs for policy training. And Ross actually asked a good question in the chat on that session as well, asking about the importance of capturing the perspectives of non-health actors. And so I think that's another area that really is open for a lot of work as well. And then in the closing session, it was in the closing session, Adesi Enekwechi talked about the experience of and the benefit of having policy experience and combining it with academic research. So I thought that was a really important perspective to share as well. And just recognizing that kind of traditional academic trajectories often don't capture that experience. And so really trying to leverage that in the field and encourage it as well. I think maybe I will stop there just to get on to some of the other topics.
Sure. And I think you had mentioned in some of your policy stuff, and we're going to move a little bit now towards, because I think all three of you guys talked about issues related to equity and how dissemination and implementation science can be used to address advancing health equity. And Ross, you had mentioned, so I'm going to come back to you, some work from Rachel Shelton. And since we're the REAIM National Workgroup, we're going to have you talk a little bit about the extension of REAIM to address equity.
Since one of the co-authors on that paper is on the line, Russ Glasgow, I might ask him to chime in as well. But, in this field, as you well know, there are now over 100 models and frameworks. We kind of lump them all together. Basically, if you're planning a study and you want to pick up a model or a framework that often have theory sort of embedded in them, there's over 100. And if you include practitioner-oriented models that are developed more for practice and research, there's probably closer to 150 out there. And this is just English language. And so it's as important as the theme of equity is for our field, and it is critical on a number of different levels. People have been, just really over the last several years, really looking more closely at how equity is being captured or focused upon in a more explicit way in a lot of the models and frameworks. And in our quick look at the literature, it looks to be somewhere between 5 and 10 of the over 100 models really include an explicit focus on equity. Of course, you could take any model and say, oh, how does this organizational element apply to a disadvantaged population, and say that's equity. But that's not really built in the fabric of a model. And that can be related to the population or to the setting, occurring in low resource settings. And so part one of this is to sort of look at what's out there and do a mapping of the models and examining both in, getting to what Meredith was talking about in the policy setting, in the public health setting, in the healthcare delivery setting. How is equity being addressed in these models? Is it an outcome? Is it part of the context of the model? Is it something that you're actually intervening upon, as in a social determinant sort of an approach? Or is it something you're just taking into account, the social determinant circumstances of the patients who are coming into a clinic? And so starting to look at those, and what we looked at, I think, was about 7 papers. And if anyone wants to see the 7 we've named, just shoot me an email. I'll be glad to share them. And Paul, you might, if you're free, you might pull up the paper. It's in Frontiers in Public Health, Shelton Chambers in Glasgow, and just put that into the chat so people can pull it up because it's an open access article. And then I'll give my overview of this article, and then Russ, maybe you can chime in. The article that Rachel Shelton led is really extending REAIM to look at the idea of sustainability and the dynamic context. And of course, the context for this is how we're working in lower resource or disadvantaged populations and how REAIM can be extended to those. And so it's sort of an extension of how REAIM's been used before. It's a thought piece. So it's not, this is one of these where I think you put obviously the original REAIM framework now 20-ish years ago, continues to be updated, improved upon, measures developed. And then this is an extension of it that I think will be really useful for people now who want to address a study, can build this in. And so that's, I think, a useful paper for those of you who are trying to take a stronger focus on equity. Obviously, a lot of interest in REAIM in this group. Russ, how badly did I mangle up that overview of the paper?
Probably did it both a lot more articulately and definitely more efficiently than I would. The only things I might add, I think that was right on, is that one of the key ways that REAIM addresses equity issues is through the factor of representativeness that we do. And as Ross said, that really, thank you, Paul, that is at multi-level. I think that's an important concept, this equity or representativeness that's involved. And the last thing that I'll say there is that I think the sustainment of outcomes, which is one of the ways that Rachel Shelton has done a great job of outlining different definitions and how we can think about outcomes, is definitely critical about across these different equity populations. But also one of the other driving factors we try to integrate there is that of cost, which is, I think, one of the, not surprisingly, dominant determinants of long-term sustainment.
Awesome, thanks.
All right. Thanks, Russ and Ross. And so, we had some other focus as well similarly related to equity, but focusing, as timely as it is, and Meredith, you'd mentioned this one, there you saw recognition for the need to dismantle structural racism. And so I thought maybe I'd kick it to you and let you talk a little bit about your thoughts on what you heard and saw and learned.
Yeah, so I saw that mentioned at the beginning, and then definitely in the closing plenary as well. And so a question was posed at the opening session of trying to think about how D&I methods can also contribute to inequity, or how, we need to examine that more and understand whether or not the field can be contributing to inequity. So that was talked about at the beginning, and then structural racism was definitely talked about more in the plenary session. I think recognizing that the field has a lot of opportunities to kind of take advantage of what we've all been going through, but then certainly the 2020 experience, I think, shone a light on structural racism, and there's this momentum right now that's building, and this opportunity to make progress. And so, the panelists in the closing session talked about really the importance of reading about our history. Could also add to that critically examining current events or history in the making. Talked about some authors to look at. I know at a group at the Center for American Indian Alaskan Native Health, we've organized a reading group. I think probably a lot of different work groups have been formed to really look at and examine what we can each do to try and address structural racism in our own institutions, but then also thinking about the field and looking at implementation generated inequalities and going beyond describing disparities and also working to confront them was talked about as something that's important. And then Keith Norris on the last, the closing panel also talked about participatory approaches and really considering who is at the table, diversifying our teams. I think from the design stage, recognizing that that is important. And then also talked about the political determinants of health that was talked about in the last session as well by one of the plenary speakers. I don't know who was the first one to mention it, but talked about really thinking, looking at the policies that have been designed to exclude people and groups from opportunities. So I think that was also an important addition and a new area to build out.
Paul, could I add one quick thing?
You certainly can.
That was great, Meredith. There was also one interesting paper that won one of the awards. Pull it up here. Megan Stanton paper on power and equity and implementation research that is something that we haven't seen covered a whole lot. And power can be who's creating the narrative, who's creating the evidence, who's disseminating that, and then of course who's distributing resources and actually trying to build the notion of power into, especially when we're using participatory approaches where there's, from the start, if you've got a research grant with a community, there's a power imbalance from the start. And so I think that was something that I found interesting that sort of layers into what you were just talking about, Meredith.
Thanks, Ross. That's really helpful. And I think it's, it really is a foundational piece of implementation science. When you talk about trying to do anything in any system, and it's especially important when you're trying to address disparities and advance equity, that the people who you're interested in are actually co-producing that evidence with you and are engaged with you from the front end. And if we're thinking about a shared leadership approach, really could even be driving the agenda rather than the researcher themselves. Let's see here. The next. Oh, I wanted to transition just a little bit because I think it's somewhat related. And Bridget, you talked about the issue of accounting for context and understanding in implementation outcomes. And I think that there's definitely a link between those things. So I'll let you go ahead.
Yeah, so one of the sessions I chaired was on understanding context in a variety of settings. And the focus of that session was the investigator of all of the presenters were presenting their work in terms of either tools or analytic methods or some combination of both that they had been working on and developing to understand the context of a given intervention in a particular set of settings that were specific to their projects. And so I think when we're thinking about context, I would kind of tag on to what Russ had said, where reach is important for understanding equity. I would also argue that adoption as well, because settings will decide to participate or not, whether they have the capacity to do what you're asking them to do. And so low resource settings will not be able to participate in complex interventions if they don't have the necessary resources, which can add to the disparities and the inequity just because of the actual place where the interventions are being conducted, which then even just compounds who's from a patient or participant perspective, who is able to take advantage of those interventions. So I think one, as these new assessments are being created or you're working on trying to understand context for the variety of settings and situations in which you're conducting your research, that I think equity needs to be a strong component in that assessment and that evaluation. And so I think there is a lot of room for that to improve and to be included, since this is still fairly new in terms of really trying to create more robust and systematic ways of evaluating context. And so the one thing I had was thinking about during that session as it was happening, and again during the actual meeting, was how do we not end up like the theories and the frameworks, which Ross mentioned that we have, over 100 of them now, and how do we make sure that we don't go down that same road when we're trying to create or think about the best way to systematically evaluate and understand context. So, years from now, we don't have another paper that says, there's 150 different ways that have been documented. And so thinking about, going to the literature, looking at the theories and the frameworks that already exist to see where they do a good job of trying to understand these contextual pieces, look at what's already been developed to try to understand that. And if there's a way to already use what's there, obviously, if there isn't, then, you need to be innovative and think about new ways. So that was kind of the big thing I was thinking of, is like, oh, this is great, but then how do we make sure we don't end up with an assessment or evaluation for every tiny little different variance in context as this part of the field moves forward?
Thanks, Bridget. I think that's a real fear, right? Is that you have a whole bunch of different measures for similar constructs, and then you can't really compare across. And of course, it strikes me when we talk about context related to REAIM that the PRISM framework that accompanies REAIM to try and provide context around, what is it that you're doing from an intervention perspective? What are the characteristics of the populations that you're hoping to have benefit from, as well as characteristics of the organizations, external drivers, and those types of things. So there's opportunity to provide context. And as you said, a lot of these theories have very similar constructs, and trying to make sure that we're not all just designing our own measures for each thing. Thank you. And so I think, I'm kind of looking through the notes that we had here, and we're at about 20 minutes to the hour. And I talked with the panelists that we'd try and open it up for questions for the last 20 minutes. So I'm going to shift there because we do have some questions that have come up, and I'm probably not going to ask them in the order because I'm going from the back to the front. And someone who is familiar to everyone that is on this panel, Dr. Borshika Rabin, asks, why do we have so much resistance for measure harmonization in the field? I'll let anybody who wants to answer that. Whoever starts first gets to answer it first.
Well, yeah, that's a really good question, Borshika. I think, I sort of think of the parallel to why do we have over 100 models and frameworks. I think it's partly there's probably a number of different things going on. One is people may not aware, they might not have done as good a job. Maybe there's not a repository to know what measures are already out there. So they might be reinventing a wheel when the wheel exists, but they just don't know the wheel exists already. I think there's also been a natural tendency to always think that, well, there are measures out there, but they're not going to fit exactly for my context. And that's usually just an issue of sort of adaptation of a measure. And then I think, you've actually led some of the work in trying to put together repositories. I think there hasn't been as much, implementation science in the scheme of things is a relatively young field. And I think it's always true in a younger field that people kind of do their own things, and there's not been a synthesis in this case, sort of a synthesis and harmonization of measures. And so I think there's probably a confluence of things. There are some efforts underway, as you well know, to try to do a better job of harmonization, but I think we still have a long way to go. I guess the other thing I would say is the way we fund, the big dog funders in the US is still the NIH. That's where the largest amount of research in this area is coming from. And the NIH is very siloed. And so if you've got a cancer grant that may not communicate well with people who are doing mental health research or people who are doing infectious disease research. So I think there's a natural outcome of sort of the siloing effect of research, the way we do it in the US, that also probably contributes to this. I don't know. What do you think, Borsika? You know this better than I do.
Thank you, Ross. I am asking it because I see still, as we are trying to do this and everyone agrees it would be wonderful to measure things similarly, that when it comes down to actually putting those measures into your studies, people are reluctant to change what they thought would be the best measure. Yeah. And so I am just not sure what is the best way. I love you highlighting that, there is a lot of work in cancer right now across the Moonshot grantees to do some harmonization, but then there is HIV work in the ending the HIV epidemic that they are trying to do HIV measurement in implementation science, and that harmonization is not happening parallel to this. So I think that I would love to see a little bit more and also understand why people end up not changing their measures when we get to the point of sharing measures.
Yeah, and Russ put a comment in about the emphasis on innovation over replication. We get scored for innovation. So if you do something new, I'm creating a new measure on this, then you get extra points for that. So I think that's also a good point.
Great, thank you. And I'm gonna move to the next question, but before I do, I'll point out that Ross did put in the chat box a bunch of references related to participatory research. If somebody wanted to copy and paste that, they'd be able to do that in response to one of the earlier questions. Here we go from Dr. Fadul, who here at UNMC. What are practical ways to address power imbalance, specifically in situations where community mistrust that resulted from prior experiences of imbalance and feeling like they're being used for data and researchers' interests? So I'm going to take the first shot at that one, if you guys don't mind. I think probably the most important thing is to have people and organizations from that community engaged with you, and to not go in and say, I'm here to do the research. And I think a lot of engagement with community organizations and community advocacy groups, contributing your time and energy to things that are important to them as you're trying to move your work forward, I think is a great way to build trust, where you might be doing things that aren't exactly in your line of research, but because of your capacity and expertise might be able to help with. And then, I'm a big believer in that if you're trying to move research in a participatory approach forward, that you need to really work hard to get buy-in from your community. You're probably pushing the wrong thing at the wrong time. Or it might be the right thing, but at the wrong time. So that's where I'd stop. I'll let Bridget, Ross, or Meredith weigh in as well on that one.
Thanks, Paul. I'll jump in just have to make a plug for PCORI. I wouldn't be doing my job. So obviously, Patient-Centered Outcomes Research Institute, we expect patients and any appropriate stakeholders to be involved in all facets of the research process. And that begins with the development of the actual research questions, so that we know that whatever is being proposed is important to the population and the people that it would ultimately impact. For groups that don't have maybe a long-standing rapport and they would like to get further connected with different groups in the community and stakeholders, we do offer engagement awards, which are specifically for that. They are not to fund research in any way. It is really to build that rapport and that engaged interaction between the groups before the research even starts. And so whether you apply for an engagement award or not, when you apply for an actual science award, we expect to see well documented how patients and stakeholders been involved throughout the entire development of the idea, the actual application, how they'll be involved during the actual implementation of the trial, and then the analyses and the dissemination of the findings. And with that, we see a lot of applications come in where patients and key stakeholders are co-investigators of the award.
Great. Thank you, Bridget. Go ahead, Meredith.
Yeah, I was just gonna make a quick comment, and I do see, looks like Kiana King in the chat said that Keith Norris is a mentor, and I was just impressed, in how his framing in the last session at the meeting talked about the importance of having full partnership, getting the right people at the table. So some of the same things that were, you all mentioned it already, and not and emphasizing the relevance of research. And he said, as a field, that we've focused more on the rigor, but it's really important to also make sure that the relevance is really driving the research. And I think that that's, that spoke to me when he said that.
Great. Thank you. And since you raised Dr. King's name, Kiana, do you want to jump in on this one? Let's see if she's still on here.
Yep, I'm here.
There you are.
Yeah, I think you've all made points that I would also make. And I think emphasizing what I believe it was Bridget that said, making sure that the community is involved in the research question development. I think that is really critical in making sure that they have buy-in from the very beginning and that they're committed throughout the process of doing the work. When they feel that they are a part of it and they have some skin in the game, they're going to stay committed to it. It'll also help it be sustained throughout the community, even after the funding ends for that particular project, and moving that work forward. The other thing I wanted to mention was making sure that the decision making doesn't fall just on or isn't just allowed by the academic partner, but that the community is a part of that decision-making process. I think some of the things that I learned from Keith in being under his supervisor and mentorship is really making sure that there is kind of a governance body that's set up with these projects, in that the community is also making decisions about how things move forward, and understanding what they bring to the table, and really having that bi-directional knowledge transfer about how things play out within that particular project.
Great. Thank you for that quick cameo appearance. Appreciate that. Let's see, we have another question that is kind of back to the context around the conference itself. So Dr. Seyu Mishu asks us, how should we plan to get the most out of the conference if we, well, I might even amend this a little bit, Seyu, to say, how might people get the most out of the conference now? Is there opportunity for them still to engage with conference materials? And then, which is actually Seyu's question, if people plan to attend the conference in 2021. And she said, from pre-conference to post-conference resources, networking events, that kind of stuff. Maybe I'll kick that one to you, Bridget.
Sure, great question. So first, to address your question, Paul, about how to utilize the resources from this past conference, I believe all of the videos of the sessions and the posters and all of the material that were available during the meeting are still available online, either till late February or sometime in March. So it is available, which is great, because unlike an in-person meeting, when there's multiple sessions you want to go to at the same time and you have to pick one and you miss the other ones, this one you can go back and see everything that you missed, which is kind of nice. So I guess a good positive about having to go to online venue. So yes, please take advantage of those materials now. As for in-person, I would say the week before the conference, get a lot of rest. pack a lot of snacks because you can totally be on the move from start to finish every day. And so if you're new to D&I, usually at the in-person meeting, there's always a kind of a D&I 101 for folks that are new to the field before the opening plenary of the meeting kicks off. And it's usually very well attended. So if you plan to do that, go early to grab a seat. Then, obviously I would get the agenda beforehand and really highlight, where you want to go, who you want to see. So you kind of have a game plan because some of the conference venues we've been at have been pretty big. So you might need to walk with a quick step to get from one session to the next. With that, wear good walking shoes so you can walk briskly or run if you need to. And also, I would recommend looking at the attendees beforehand. So if there's people that you would like to have a few minutes of their time, you can see if they are registered to attend or if they're presenting, and reach out with them beforehand to see if you can schedule a quick coffee break or just, and to be able to introduce yourself. And if you do that, I would recommend, coming prepared, have some key questions that you want to ask of those folks. And hopefully that will allow for further conversation, maybe via email or phone post-conference. But yeah, I think, and then obviously attend the posters because that's always fun because that's where you really can have a lot of one-on-one interaction with folks about their research and what they're doing in the field. But again, you just rest up and plan your agenda and you can have a lot of fun and take a lot of advantage of things. And then you go home and you're exhausted, but you're just so happy because it was such a great time.
Thank you, Dr. Gaglio. Excellent.
One other thing I might mention, Paul, sort of following the timeline of when abstracts and when things will be submitted, also start thinking early about what you might submit as a presentation or a poster. And Bridget did a nice summary before about the different types of presentations so that you don't suddenly see, oh, here's a deadline coming up and now I have to scramble to get something ready. But think about where one of your projects might be ready and start taking a little longer planning. I think that could be helpful too, because it's really a great venue to present or to show a poster. And it was really nice this year where there could be a higher volume of things because of the way it was done.
Also excellent advice. And so I put in a final opportunity for folks if they had any highlights from the 2020 meeting that people wanted to put in that chat. I have not seen anyone do that, although it's only been in place there for the last 2 minutes. Oh, there we go. Dr. Glasgow, why don't you go ahead and take the screen and actually talk about this, and you'll give people a chance that if they have things they wanted to put in, they can do that while you talk.
Yeah, just briefly, I think some of the newer analytic approaches, including configural analysis, I think I can't pronounce his name correctly, but Ed Mike, I think, led a really nice session on that. And then also J.D. Smith led some work he and Hendricks Brown and others are doing, kind of integrating, well, it's a little more sophisticated than a smart design with stepped wedge, but thinking about how you can actually optimize the design and modify while you're going, rather than just testing a static intervention and finding out after the thing's over that it didn't work so well.
All right. Well, it's
And
probably.
I would like to put a plug in for if people have time to watch the presentation. I think it was a session on the first day that Borsica moderated on looking at fidelity and for implementation in the time of COVID. And that really resonated with me, obviously working for a funding organization when, 10, 11 months ago, you have every research project you've funded come to a screeching halt because everything's closed. And then, everything's on pause for 4, 5, 6, some places are still on pause. And as things start to reopen, what does research look like compared to what you originally funded? And so looking at all of these adaptations that are having to be made and whether they're fidelity congruent or not, and why, and does that allow individual to still be able to answer the original research question they intended to answer or not. And so that is something I've been working on day and night since the pandemic started. And so to see that presentation really resonated with me, and I think would be a value for folks to watch when they have time.
All right. Well, I'm going to give Ross and Meredith a last opportunity before we shut things down here.
I don't think I have anything very profound to say other than thinking about if this, I guess, Bridget, we're assuming next year it's just back to an in-person meeting. Is that our working hypothesis right now?
That is the working hypothesis, but again, subject to change on how this all plays out in the next year.
Yeah, show your vaccine card on the way in or something.
Exactly, exactly.
So I think maybe it's thinking about the formal and informal part of a meeting like this that Bridget alluded to, that there's a great thing from the sessions, but there's probably as much you get out of these from who you meet, who you have coffee with, who you have been wanting to connect with but hadn't had a chance before. So really trying to make use of that networking opportunity that happens that is really nearly impossible to do in a virtual platform. So really take advantage of being back in person, I guess, would be the only other thing.
Great. And Ross, Russ did type in here, he wanted you to mention the ISC3 national meeting.
Yes, you're going to probably ask me to give the date of that, and I'm not going to be able to do that. You have the date, Russ. You should know that. So while you scramble for the date, so there's the internet, the Cancer Control Consortium. There's a sort of a national group that's gotten together, and then there's a group of centers that are funded under sort of a broad umbrella of the Moonshot, along with a whole bunch of other Moonshot grants that I'm sure many on this call are involved with. And there you have it. There's going to be a national meeting in early June. And you can, one of the best things to do is also just subscribe to the Implementation Science newsletter out of the National Cancer Institute. Bridget, you probably have some favorites in the PCORI world as well. Get on different mailing lists of things like this so these opportunities come along.
Great. Thank you, Ross. And Meredith, I'm going to give you the last word today.
Okay. So I think I would just say that, I've only attended twice, once in person and once in this online format. And I was just going to point out one of the advantages, I think, to the online format that I saw was shown at the beginning with a plenary poll of attendance. And this may have been an advantage of being able to open it up to more people. But about half of the participants, at least those who answered the poll, said that it was the first meeting that they're attending. So I think that was something kind of important to think about. And then I do a lot of work internationally, and it was really nice to see on that opening session also the the people participating from India, Philippines, Nigeria, Guatemala, South Africa, some being able to take advantage as well of the meeting. So potentially, if there's a way to continue that moving forward, and also patients. I remember that was mentioned as well. There was an effort to include more patients. So I think trying to expand the access is something that was an opportunity that did happen this year, and potentially if it does return back to an in-person format, that could be continued in the future.
Great. Thank you. And with that, I'll thank everyone else for joining us today, and watch out for another one of our webinars in about 3 months. Take care all. Thanks, Bridget. Thanks, Ross. Thanks, Meredith.
Yeah.
Thank you.
Thanks, gang. Enjoyed it,
Meredith,
Bridget, Meredith,
Ross.
and Paul.
All
Guys,
right.
take care.
Thank you.
Stay well.
Yeah, you too.